surgical hair restoration. It's basically advanced techniques for permanent results. We use state-of-the-art surgical methods. Our design is for natural look, especially the hairline. It provides long-term and permanent results as long as where we take the hair from, which is from the back and sides, that's considered permanent hair, and we place it elsewhere where it will continue to grow. And there is a customized approach for each patient. The thing is that this is what we call donor dominance, not recipient dominance. And what that means is that where you take it from, the hair is going to act that way from where it came from, as opposed to taking it from there, placing it somewhere else, and having where it was placed become how it's going to act, which would mean in this case, it would not last. So donor dominance is what we have. It allows for the hair to remain for the rest of your days. And that's why hair transplants work. Quick history. Basically, there were hair transplants done, believe it or not, in the 1800s. They certainly haven't been documented well. The first real documentation and studies were done in the 30s and 40s by a Dr. Okuda. And I actually heard a lecture from his son. It never got out because that was the time of World War II when everything got shut down from the Axis side versus the Allied side. And so it never came to light until the late 80s, early 90s. The modern era began with the Dr. Norman Ohrenreich out of New York City, and they used to do some testing by taking a punch, a 1/4 millimeter punch, I'm sorry, a 4 millimeter punch, and moving it elsewhere. And they noticed that the hair grew in the new place. So what they started doing was using these punches to move the hair. And it looked like doll's plugs, but it was the only thing they had at the time. In the late 80s and early 90s, a doctor, and I'm blocking on his name at the moment, but I'll think about it. Anyways, he thought about the fact that you could take a strip out, cut the strip out, and bring it into individual micrografts. Now, a follicular unit is not a single follicle. A follicular unit can contain anywhere from 1 to 4 hairs. And that's how nature has grouped them together. So when we say we're going to do 2,000 grafts on you, for the average Caucasian, it's about 2.2 to 2.5 hairs. So you're looking at somewhere between 2,200 and, you're looking at somewhere around 4,400 to 5,000 grafts, 5,000 hairs. In the early 2000s, Rashman and Bernstein, doctors, one on each of the coasts, tried to do some follicular units in something that they called the Fox test. And they could not quite perfect it until around 2010, when a Jim Harris out of Colorado figured out how it would work. And he started off with a 2 millimeter punch, went down to a 1 millimeter punch that was hand done. So there was a lot of work done in it, in the fingers, repetitive work. Recently, in the last couple of years, I have developed what's called the no shave technique along with Thomas. We've been able to actually not shave the back of your head, and he'll talk a little more about that, so that when you walk out of here, the back of your head will look like nothing was done. The grafts were removed individually without any shaving. The strip method. I'm kind of the guru here of the strip method because Thomas, coming in late to the game at his age, no one is really asking to do the strip method anymore. Strip method is where you take actually a piece of tissue out, you hand it to your technicians, and they take that and cut it up into individual follicular units. So instead of using a punch to get a follicular unit, you actually take the strip and you cut them up into individual follicular units. You make the recipient sites. You're seeing in the third from the left, that's the graft dissection that they do. And then they make the recipient sites. I make the recipient sites actually as the physician, and the technicians place the grafts in those. This does require sutures. We do a 2-layer closure and requires the sutures to stay in anywhere from 12 to 14 days. The graft placements are carefully placed one at a time in the proper angle, direction, and depth. The advantages of the FUT. Well, this has between 3,000 and 4,000 grafts. Realistically, we've done between 3,000 and probably close to 3,500. It is possible to do up to 4,000. That is a really big procedure. It takes about 6 technicians to do. It takes hours as well. So we try to maintain it to a time where we don't have to keep the grafts out of the person for more than 3 hours. We can get maximum coverage with this, although with the FUEs now, we're getting so good at it in a positive way. It's a matter of speed that we're getting better at, not precision of doing it. So we're getting up to 3,000 grafts out of the FUE. And once again, Dr. Brand will talk about that. Graft survival. Once you get the grafts out and cut, there's no difference between the two methods of the FUE versus FUT. The grafts are the same size, the holes are the same size, the replacement is the same way. You do end up with a linear scar in the back of your scalp. It's a fine line. For some reason, people are just afraid of this now. Everybody wants an FUE. I do less than 5% FUEs in the practice, and FUTs. Our FUTs in the practice. Our FUEs shaving are about 53%. Our FUEs no shave are about 47%, somewhere in those vicinities, and there's a couple of percent for the FUTs. I know that the 47 and the 53 added up to 100, so don't correct my math, please. But take a few off of each of those, and you will see that it really has changed dramatically. And I know that this year, the number of no shaves will outpace the number of shaves. The candidates, basically, the best ones to get most coverage are going to be the ones with the most hair loss, which would be the 6s and 7s on the scale. But in reality, for the first 20 years of my practice, that's all we did was the FUTs. It's a great procedure. I have no problem doing it. I think it works out extremely well. The results are no better or no worse than the FUEs. So understanding that people don't want to do the FUT, that's perfectly fine. You get maximum coverage in fewer sessions, and wearing your hair longer, it's fine. You can wear it longer or shorter without a problem. The recovery is you're going to have sutures in for 12 to 14 days. You're able to resume your regular activities in 2 to 3 weeks. And the full results, like the others, you see between 12 and 18 months. You should really see a significant difference in 12 months, but some people are sooner, some people are later. The other difference is that the FUT is a little more painful, and the pain lasts a little bit longer than the FUE does. These are examples of FUTs. You see the one gentleman on the left side, he's actually was a professional wrestler, and now he's an actor. He's a really nice guy. It just so happens he's the son of a gentleman I went to school with. So nice guy. And he doesn't look in real life as mean as that. He's just a very pleasant young man. So on the right, this guy is Ken. He's a great guy. You can see the difference in his hair. He's thrilled. I actually just talked to him a few days ago, and he just sent us somebody in to take care of. So referrals are definitely our best patients because they're being sent in from happy patients. So.
Well, the next thing we're going to talk about is the FUE. And I'll tell you, I have had both the FUT and the FUE performed by Mark. In fact, Mark and I are like perfect examples of different way to maintain your hair. So Mark has never had a hair transplant, and he's got that nice head of hair because he was wise enough to start finasteride as a younger man. And so that's why he's got those lovely locks. Me, I would be much more bald than I am if I hadn't had both an FUT and an FUE. But having done both, just from personal experience, and Mark says the FUT is slightly more painful. It's definitely more painful than the FUE, and the recovery time is longer, and I think the swelling is more significant. But it's an excellent procedure that will give you great coverage for your hair. But if I had my choice, or if somebody offered me, do you want an FUE or an FUT? I would definitely, for me, choose the FUE just for the quickness of recovery and the pain. So anyways, what is an FUE? So it stands for follicular unit extraction. And as Mark explained, your hair doesn't grow as single hairs, but grows in follicular units. So when you look, there's actually each one of these hairs that they on the left-hand side that they show growing as a single hair is really between 1 and 4 hairs. And it's interesting that that's the way that your hair grows in all these follicular units. And if you were to count, you may have somewhere between 60 and 100 follicular units in a centimeter squared. And we're taking 1 out of every 5 follicular units, so that when we remove them, the other hairs that are there will cover, so you can't tell that we've removed any of your hair. So where do we take the hair from? Well, we take it from the back of your head, because the back of your head has hair that is resistant to testosterone, meaning that hair back here does not have the enzyme 5-alpha reductase to convert testosterone to dihydrotestosterone. And so it doesn't thin out, and it stays. So you see all kinds of men who have tons of hair back here, even though they've lost everything at the top. And that's because this hair is either doesn't have the enzyme or is not affected by the enzyme. So when I move it anywhere else, it's going to grow. So we're taking those hairs from the back of your head, and then we can move them wherever we want. If you want hair on your shoulder, we can put long hair on your shoulder. Most people prefer to have it in the area where they're bald, and what we do is we're extracting. So we're cutting on the picture on the left-hand side. We're going around the follicular unit, and then a technician is coming right behind me and pulling that follicular unit out and putting it on a petri dish, and separating them between follicular units that have 1 hairs or 2 hairs or 3 hairs or 4 within them. And then we're going to place those different size follicular units in different portions of your head based on what is going to look most natural. So it says here, recipient sites are created in balding areas by the surgeon. What that means is we're going to make sites. Mark or I are going to make sites. We're going to draw a hairline that you are happy with, and then we're going to make sites for the technicians to then put the grafts into, and how we place those grafts, what direction they're going, what the design looks like, is to make it look like you have a natural appearance when the whole procedure is done. You can go change, Michael. So what are the benefits? Well, the benefits, besides being not painful, is you don't have a linear scar, which the linear scar, for the most part, most people can't see. But if you're somebody who, say you're in the Marines, or you just like a really tight hair in the back, that linear scar may be visible. So that's why it says you can wear a short hairstyle if you don't have an FUT, or if you get an FUE, you can wear your hair short. The recovery time is definitely quicker. There's definitely less discomfort, and occasionally we will use hair from somewhere else. For example, we can take your beard hair, and you don't necessarily want to put it in the front, but it is good for filling in the back. A lot of hair is not necessarily a great choice. For example, you could take chest hair and put it on your head. However, different hair has different growth or anagen stages. So the hair on your head will be an anagen phase or the growth phase between 2 and 8 years. So it'll continue to grow for a long period of time. Your chest hair will only grow for 2 to 6 months. So if I put it up here, again, it's only going to grow for 2 to 6 months, and it'll only grow so long. Your beard hair, which can grow a little longer if we were to transplant it, will last longer. So if I were to choose to use a non-head hair, probably your beard hair would be the best choice for that type of procedure. And a few people have chosen to do that just because they don't have enough natural donor hair from the back of their head. So this says it's fewer grafts. That's really not true anymore. We'll get, typically between 2,500 and 3,000 grafts fairly often. And I can't read all this stuff because Mark's in the way. But so it's definitely ideal for people who don't want to have a linear scar, and for people who are looking for less discomfort. And here's some nice examples of people who've had an FUE, and you can see the outcomes are just as good, if not better, with people who've had an FUT. And you can see how happy we are here with a new hairline. And then same here, this person had 2 procedures, one to cover the front and a second procedure to cover the back. And this is sort of the same thing. This is John on the right, who, looked forlorn before he had his hair transplant, and now look how happy he is after all those luscious locks in the front. So I started with Mark, now going on 5 years ago, and I actually had a hair transplant done by Mark myself, and I was so impressed by his work. And we had both been emergency medicine doctors, and we got to talking, and he was willing to train me on how to do this procedure so that I could give other people the same change in their appearance that I got. And I really appreciated it and wanted to be able to share that. And the nice thing about Mark is Mark has always been on the cutting edge of hair transplantation from the beginning. So he's been doing it for a long time, but he hasn't just stuck with the same procedure for the last 30 years. He's constantly trying new things. And so when I started with Mark, he said, look, we're going to do a no shave FUE. Nobody else is doing it, and we need to learn how to do it. And so together we have worked hard and perfected the ability to do an FUE without shaving the back of the head. And so other people may say they do a no shave FUE, but really Mark and I are the only ones who are doing it on a regular basis and successfully, probably in New England. But I know other people say they do it, but I highly recommend us just because we've been doing it for a long time now. So, what's the difference? So the guy on the right has had an FUE where we shaved his head so you can see every follicle and be able to get the hair or the follicular unit fairly easily. But when you walk out of here, you're going to have a shaved head, and it's an interesting look to have hair on the top but shaved in the back, or some people we shave the entire head. And a lot of people, so we see people who are they are constantly in the public. Maybe they're on television, or maybe they are just constantly having to speak to people through the computer, and they just don't want to have this look. And so they want to have the no shave technique. And so this person on the left has had the same number of grafts removed, but without shaving his head. It takes a little longer and requires a little bit of extra time in order to do it. But you can see you don't have to walk out of here with a shaved head. And so when you leave the department, you look the same as when you came in. The only difference is now you have new grafts wherever you wanted them placed. So we extract the hair. We don't take away any of your hair that's there, and it's very discreet. So this is sort of saying the same thing. And when we do this, we're able to select which hairs we think are good. So, for example, if you have gray hair everywhere, and we take only black hairs and we put them down the middle, we can create a racing stripe effect if we're not careful. So it's important to sort of match the hair that we remove from the back to the hair that we place in the front so that it looks the same. In addition, you don't want to put a graft that has 3 or 4 hairs in it in the front, because it'll have that same look that back in the day when they were doing plugs, where it just looks too thick and non-natural. And we want to put single hairs in the front, and then the single hair follicular units in the front, and ones with 2, 3s, and 4 hairs behind that to give it a more natural and thick look. And then this is I'm just looking, it says recipient sites created within the existing hair. I'm not sure what you meant by that, Michael, but the point is, you don't cut your hair, so that when we place it into the new areas, any hair that you have, we don't have to cut that either. And it takes a lot of work by the technicians. Unfortunately, the technicians have learned right along with us and are very good at being able to do this procedure.
Just as a note, he mentioned the technicians. Our technicians have been here for 8 or 9 years. They're very experienced. They've done well over 1 million graft placements and dissections. So this is not a place where, it's a fly-by-night where people are, technicians are coming and going. We are very stable with our technicians, and they're outstanding at what they do.
Well, this is just another picture showing the same thing, where this on the left hand, this is when he came in for his procedure, and then afterwards, you really can't tell that anything was done. And as soon as he walks out, so if you have seen people on flights to or from Turkey, you'll see the entire plane is covered with people with bandages on their head. Whereas after this procedure, you walk out, there's no bandages, you look just the same as when you came in. And then here's some other cases. This is Jimmy Shirts. I guess he got his name because he wears crazy shirts all the time. And you can see his outcome is exactly the same, only he didn't have to shave his head, and the same thing with the gentleman on the right. The one thing I'll say about a no shave is we typically don't do more than, say, 2,000 grafts. So if you're somebody who needs to have 3 or 4 or 5,000 grafts, it may not be the best choice for you. Although, unless it's requiring, multiple procedures to do that. And then, so here are the key advantages. A lot of people will go back to work the next day because you can't really tell anything is done. So people will go out that night. They may wear a cap or something to cover the front because that might look slightly different, but you won't see anything in the back. And they can resume their normal activities after a week or so, meaning we don't want people exercising and getting really sweaty and that kind of thing for the first week. We wanted you to be careful with the new grafts. As far as hair transplant for women,